Have you ever been lying in bed, finally comfortable, only to get hit with a sudden painful leg cramp that makes you jump up? Or maybe you fall asleep but wake up feeling unrefreshed? By mid-afternoon, you're dragging, your energy is gone, and your blood pressure readings might be creeping higher. If that sounds familiar, you're not alone, and it might not be just aging. The mineral that's often suboptimal for many adults over 50 is magnesium. Getting enough can support better sleep, help calm muscle cramps, boost daytime energy, and contribute to healthier blood pressure levels. Stick with me for the next 10 minutes or so, because I'm going to show you exactly why this matters, and the simple, natural ways to fix it, safe supplement guidance, and a practical plan you can start this week. Hello, I'm Dr. Michael Carter, and welcome to Premium Health Harbor, a channel I created with one clear mission: to help you cut through the confusion and get practical, science-based health guidance you can actually use in real life. Here, we'll break down topics like nutrition, fitness, sleep, stress, prevention, and everyday wellness, step by step, so you can make smarter choices and feel your best. Now, let's get into today's video. Magnesium is involved in hundreds of biological processes and enzyme reactions. It acts like an orchestra conductor for energy production, muscle relaxation, nervous system calming, heart rhythm, and more. After 50, several factors can lead to lower intake or stores: reduced absorption efficiency, common medications such as diuretics for blood pressure or certain heartburn drugs that increase losses, dietary shifts toward processed foods, and, in some analyses, lower magnesium content in modern food supply due to soil and processing changes. Many older adults fall short of recommended intakes around 420 milligrams daily for men and 320 milligrams for women over 51. Most people aren't in dangerous clinical deficiency, but many are running on suboptimal levels for their body's needs. Routine blood tests, serum magnesium often miss cellular shortfalls, so symptoms can appear even with normal results. A red blood cell test can be more informative, but it's not always ordered. This video is for educational purposes and is not personalized medical advice. If you have kidney disease, are on dialysis, have serious heart rhythm problems, or take prescription medications, do not start supplements without clearance from your clinician. If you experience chest pain, fainting, severe palpitations, sudden swelling, or shortness of breath, seek urgent medical care. Symptoms like fatigue, cramps, and poor sleep overlap with many conditions, including thyroid issues, iron or B12 deficiency, dehydration, sleep apnea, medication side effects, and circulation problems. Magnesium is one piece of the puzzle, not a diagnosis. Talk to your healthcare provider. A patient I'll call Margaret. Details changed for privacy was 67. She was waking multiple times nightly, dealing with frequent leg cramps, afternoon exhaustion, and rising blood pressure despite eating decently and walking daily. Working with her prescribing doctor, we reviewed her medications and diet, then optimized her magnesium intake through food and an appropriate supplement. Over several weeks, she reported sleeping more soundly, far fewer cramps, steadier energy, and her doctor was later able to adjust one of her medications. Her experience is common but not guaranteed. Individual results vary. Some people notice meaningful improvements. Others see modest changes or need a broader workup. Common signs that may point to suboptimal magnesium include persistent fatigue or afternoon energy crashes. It's essential for turning food into ATP energy. Nighttime leg cramps or muscle twitches. Magnesium helps muscles relax after contraction. Trouble falling or staying asleep. Mood changes, irritability, or feeling on edge. Elevated blood pressure readings or occasional palpitations. It supports blood vessel, relaxation, and steady heart rhythm. It also works with vitamin D for bone health, helps stabilize blood sugar, and can reduce certain inflammation markers. In a 2021 systematic review of studies focused on older adults, magnesium supplementation was associated with falling asleep roughly 17 minutes faster on average, with some improvement in sleep depth, though the evidence quality was rated low and clinical significance is modest. Many people also report waking less often at night. Sleep quality is often noticeable in 1 to 3 weeks. Leg cramps 2 to 6 weeks. Energy levels 2 to 8 weeks. Blood pressure support track consistently for 4 to 8 weeks. Never adjust medications without your doctor. Results vary. Some notice a big difference, others a modest one, and some benefit most from addressing other root causes. Magnesium can help when intake is low, but cramps are multifactorial. Consider this combined approach. Optimize magnesium through food and, if appropriate, supplements. Stay well hydrated and balance electrolytes, sodium, potassium, magnesium. Do gentle calf and foot stretches before bed. Review medications, especially diuretics, with your doctor. Address other factors like circulation or overall mineral balance. This comprehensive view prevents disappointment if magnesium alone doesn't resolve everything. The safest starting point is food. Your body absorbs it well and you get co-nutrients. Easy daily template. Aim to include 1 serving from seeds or nuts, 1 leafy green, and 1 bean or whole grain most days. Examples: breakfast, oatmeal or yogurt with a handful of pumpkin seeds or almonds, about 150 milligrams from seeds. Lunch, spinach or Swiss chard salad, 150 to 160 milligrams per cooked cup. Dinner, black beans, 120 milligrams per cup. Quinoa or lentils with sautéed greens and avocado, about 60 milligrams. Evening, small square of 70% plus dark chocolate, 50 to 65 milligrams. Other options: salmon, bananas, oats, or brown rice. You don't need perfection every day. Consistent addition over weeks often brings benefits. Most people currently get only about half the recommended amount. Food first is ideal. If diet is limited or symptoms are pronounced, a supplement can help bridge the gap after discussing with your clinician. A typical supplemental target is up to about 350 milligrams elemental magnesium daily for most healthy adults. Form guidance. Magnesium glycinate. Often gentlest on the stomach. Excellent for sleep and relaxation. Magnesium citrate. Absorbed well, but can have a stronger laxative effect, useful for constipation, but may cause loose stools. Magnesium oxide. Poorly absorbed for most purposes, sometimes used short-term for constipation, generally not first choice. Start low 100 to 200 milligrams elemental in the evening and increase slowly. Take glycinate about an hour before bed for many people. Space doses 2 to 4 hours from antibiotics, thyroid medications, or bisphosphonates. A common side effect is loose stools. Lower the dose or switch forms if this occurs. Magnesium works best alongside adequate vitamin D, potassium-rich fruits or vegetables, and good hydration. It's one supportive tool, not a replacement for medical care. What if magnesium upsets my stomach? Switch to glycinate, take with food, or reduce the dose. Can I take it with my blood pressure medication? Usually compatible, but always confirm with your clinician and monitor your readings. Morning or night? Evening is often preferred for its calming effects on sleep and muscles. Which form for sleep versus constipation? Glycinate for relaxation or sleep. Citrate if you also need gentle bowel support. How do I read the label? Focus on the elemental magnesium number. That's what matters. Aim for 200 to 350 milligrams supplemental elemental per day in divided doses unless your clinician advises otherwise. Let's bring it together. Magnesium is the mineral many adults over 50 don't get enough of for optimal needs. It supports energy production, muscle relaxation, nervous system calming, sleep quality, heart rhythm, and healthy blood pressure. Symptoms like fatigue, cramps, poor sleep, and irritability are often blamed on normal aging but can improve for many when intake is optimized. The practical approach: prioritize magnesium-rich foods every day using the simple template seeds or nuts, greens, beans. Consider a gentle supplement like glycinate in the evening after talking with your clinician, especially if you have kidney concerns or take medications. Be patient, track your symptoms, and remember results vary. Some people feel a big difference. Others notice modest improvements or need further investigation into other causes. You deserve to move through these years with more comfort, better sleep, and steady energy. Many of the steps are simpler than they seem. If this helped, hit subscribe and the bell for more videos on healthy aging. Drop magnesium in the comments below. I read every one, and it helps me know what topics matter most to you. Want a free magnesium-rich food guide with recipes and a symptom tracker? Comment guide and we'll send the link. Thank you for watching. This is educational information only. Work with your healthcare provider for personalized advice. Take care, eat well, move gently, and I'll see you in the next video on the surprising gut energy connection after 50.